Okay. Hopefully last week you checked out my show on free market healthcare. And if you haven't, go to the website, am1380thebiz.com, and look up the podcast. It was really, really fascinating stuff. And I'm going to get a little political again today, something I don't normally do on this show. And joining me now to discuss healthcare policy and related issues from a libertarian perspective is Libertarian Party presidential hopeful Austin Petersen. Hi, Austin. Welcome to the program.
Thank you for having me on the show.
You bet. Okay, because this is a radio show dedicated to health and disease issues, I want to pick your brain on these topics. First, just to put it out there in case people in my audience aren't familiar with libertarianism, can you give us a short primer on libertarianism?
Absolutely. A libertarian is someone who believes in maximum economic freedom and maximum personal liberty. Republicans and Democrats tend to cut our liberties in half, where a Republican might say, well, we want to cut your taxes. We want to allow you to keep the fruits of your labor, but we want to know what's going on in your personal lives. We don't want you to get married. We don't want, gay marriage to exist or something like that. So they clamp down on your personal liberties there. But a Democrat would then say, well, we want to allow you to have your personal liberties. We don't mind if you get gay married, and we want to end drug prohibition, but we want your money, and we want to have high taxes. So a libertarian says we want to have your taxes low and allow you to live your personal life as you see fit, provided you harm no one else. And that's what a libertarian really means, is that you get maximum freedom to do as you please, provided you harm no one else.
Okay, excellent. So that's a good segue into my following questions. And let's start with the role of the federal government in healthcare. Is there one? And if so, what is it?
I would say not. The reason why I disagree with the federal role in healthcare is because central planning always fails. Central planners always have a difficult time planning for a nation of 300 million people. It's very difficult for people to be able to administer healthcare in a central formal fashion. States might be able to set their own policies on healthcare. That might be perfectly fine in a federal system such as we have. But my issue is that I think that the profit motive is actually a good incentive because it creates the pricing system, and it's through the pricing system that we can more effectively allocate resources. I believe in a free market in healthcare. We had the best healthcare system in the entire world before government got involved, and it seems to have been degrading ever since. So I don't see a federal role in healthcare whatsoever at all.
Good. Now, that's interesting because people my age and younger, I'm in my early 50s, we've never known anything other than government involvement in healthcare. And so how did we get into the place we are now?
I think it sort of creeps in. You get the camel's nose into the tent, as they would say. The idea is that you start by doing things like demanding that hospitals treat everyone regardless of their ability to pay. So you start with something that sounds good for most people, and they say, well, we can get a broad amount of consensus. We can get a broad consensus on this issue because no one wants to see anyone go into a hospital if they're dying or deathly ill and not be treated, even though that wasn't really going on before that law existed. And then you take another issue like with what was Obamacare? How did Obamacare get passed? Well, Obamacare got passed because of the one issue which they were able to get a broad consensus on, which was no pre-existing conditions. And because it sounds good, because it feels good, because it gives people that emotional release that they have, then you're able to pass that kind of legislation, despite the fact that it doesn't actually give you the outcome that you really want, and unless you're talking about that narrow constituency. But politicians ignore the laws of supply and demand. They ignore the laws of economics. And healthcare is a service just like fire and utilities are a service. And they create an unsustainable model with this. The laws of supply and demand will eventually win out, no matter how much politicians try and stop them, because, again, people will make their choices in the marketplace regardless. So what I mean when I say this is, if let's say you had a fire insurance company, if if you could buy fire insurance while your house was on fire or after your house had burned down, would anyone purchase fire insurance before the fact? Of course not. So the problem with the pre-existing conditions clause in Obamacare is that it allows people to purchase insurance after their house burns down. This creates an unsustainable model. And eventually Obamacare will collapse on its own merits. The insurance industry will collapse because of this, because there's no incentive. Well, the incentive is, of course, that they force people to buy health insurance now. And so they come out with the iron fist. But again, the laws of supply and demand are always going to catch up with us in the end. So I see this as on an unsustainable path, and eventually our healthcare system will buckle under this pressure.
Right. Now, on your website, you have a short statement regarding this topic, and this is what you say you would do: overturn Obamacare, seek out market alternatives to problems of health and wellness. Mm-hmm. Okay. Right. Explain how this has worked, because you know as well as I do that no government program ever goes away. Right.
Yeah. So here's the story that I like to tell so that people can understand why I think a free market in healthcare is superior. Let's take eye surgery as an example. Eye surgery is an elective procedure. Arguably, it is healthcare, but it is elective, so insurance doesn't cover it. You have to pay for this out of pocket. You have to, earn your own money and go out and buy eye surgery on the free market. You choose your doctor. You decide who you will be purchasing this surgery from. Well, what's happened? When we initially had eye surgery, it was very expensive, and sometimes it would revert. So it wasn't a high-quality procedure. Sometimes your eyes would go back to what they were before. And what's happened since the advent of eye surgery? The prices come down and the quality has come up because the market has been allowed to work. Libertarians want to allow that to work in other surgeries as well. We want to allow the gig economy, as you might say, just like Uber might operate. We want to allow those kinds of services to operate in the healthcare system. And, the government stepping in such as they have, it does remove the role of charity in society.
Right.
The Catholic Church would love to come in and do more operations. The Catholic Church would love to step in and do more charity, but they are so hyper-regulated that it makes it difficult for people to do so. So the government crowds out the private market.
Okay, so let me get it clear then. If you were elected and as President of the United States, you would, request a bill from Congress to overturn Obamacare, and then you would just say, that's a wrap.
Yeah. Yes, I would. Absolutely. It's clean and clear and simple as that.
Okay. I like it. Mm-hmm. Now, we know about the Democrats. They want more and more federal government in healthcare, but I think maybe the Republicans do also. But one thing they frequently say is they want to repeal and replace Obamacare. Austin Petersen, replace it with what?
Well, when you remove a cancer, what do you replace it with? The reality is that the free market means that the people have the choice to go where they please, that your dollars go with you. I like the idea of health savings accounts because they tend to be more market oriented, and that when you have the money in an account, you choose how to spend that money or not to spend that money. It gives that to me is a much better incentive. So I would discuss those kinds of market alternatives, but I would not be involved in central planning. So when we talk about replacing it, there would not be any attempt to replace it. We would just start to break down the government involvement in the healthcare industry totally.
Yeah, one of my guests last week, he runs a surgical center in Oklahoma City, which doesn't take health insurance and doesn't take any government money or anything. It's all cash. And I asked him pretty much the same question. His answer was replace and acknowledge. Tell the politicians to replace it or repeal and acknowledge. Repeal it, then acknowledge that the federal government has no right in health care. So
right.
Really good.
President Obama won't be on Obamacare. I promise you that.
Okay. All right. Everybody's favorite Donald Trump has brought the disastrous care provided by the VA health system to the forefront. What would you do as president to quote unquote fix the VA?
Well, there you are. I mean, that's socialized medicine on display right there. The failures of socialized medicine are on display. Government health care right there. They're unable to provide health care to the people who have sacrificed all for our country. In my utopian world of worlds, if I could have anything that I wanted, I would love to abolish the Department of Veterans Affairs entirely and take the money that we save from this bloated bureaucracy and give it to the veterans in the form of a direct check so that they can seek out health care in the private market on their own.
Okay, good answer. All right, now, your main opponent, I believe, in the LP is Governor Gary Johnson. And is there anything concerning this topic that you guys differ on that you're aware of?
That's a good question. He doesn't talk much about health care. He's much more of a marijuana guy. He tends to focus on that topic, so we haven't seen much of him. But I think he does oppose Obamacare. Yeah. So there hasn't been much of a debate between Governor Johnson and myself on health care. We tend to agree on a lot of things, sure. But some of the things that we do disagree on aren't related necessarily to health care as much as they are about private property.
Yeah. Well, yeah. The reason I wanted to throw that in there is because I did go to his website and I couldn't find anything concerning that. Okay. Right. Yeah. He's very marijuana focused. It's kind of a one issue candidacy over there. But I agree with him. I agree with him on legalizing marijuana. I would take it a step further, and I would legalize all drugs. Simply because, one, I think that you own your life and your body, and again, should do with it as you please. But also, I think that drugs are much more dangerous because they're illegal. And just like we had alcohol prohibition, it made alcohol much more dangerous with people manufacturing it in stills and in bathtubs, and it being a much more dangerous concoction than it is when it's fully legal to purchase. Yeah, you kind of got a little bit ahead of me. I was going to ask you concerning that. Do you look at the drug abuse problem as a medical issue or a criminal issue?
Well, I do see it as a medical issue, and I've known too many people in my life who have struggled with chemical dependencies. The people who had the most problems were the people who struggled with legal drugs, whether they be pharmaceuticals that were given to them by prescription or whether they were alcohol or tobacco. And it's these drugs which people really struggle with the most, these legal drugs. And so when I look at issues like heroin or methamphetamine, they seem to me to be sort of the red herring when we're talking about which drugs are really the most dangerous. To me, it seems like the most dangerous drugs are alcohol or tobacco, but we don't make those illegal. And it's because we don't make those illegal that people are able to seek treatment. We have professional treatment centers, and people who overdose are much more likely to seek treatment. People, who have alcohol dependencies, they have support clubs, and that exists for illegal drugs as well. But it's much more under the table. And I think that when you're looking at something like biker meth, methamphetamine, these drugs exist because people are seeking opportunities to get high, and they go into their labs and they create all of these dangerous drugs because of their inability to get access to something that might be safer. And drug dealers also don't check IDs. So to me, the black market, it creates danger not only personally for individuals, but it creates border violence. A lot of people are worried about the security on our southern border, and a lot of that has to do with our criminal war on drugs. $1 trillion spent fighting a war that's been a war on our own people, trying to reform them of their vices and sins. I think that it's absolutely abhorrent. I think that it's unworkable. I think it's a waste of money, and I think that it should be repealed immediately.
Okay. Now, sticking with the medical issue, though, this treatment, how would that be financed? Would that be through the government, or would that be through private?
Absolutely not. The best clinics that we have are the private clinics. And so I think that we should allow those to spring up. Again, when the government steps in and regulates the healthcare system, they say they break our legs and then they give us a crutch. The thing is that you're not going to find more people doing heroin because it's legal. Would you do heroin if it was legal? The type of people who are going to be addicted to these kinds of drugs are going to be addicted to it either way. Throwing them in prison doesn't do anything to cure them of their drug habits. All it does is put them in a situation where actually a lot of them will become hooked on more drugs because you can't keep it out of prison.
I'm sorry, but how would somebody that's a heroin addict who probably doesn't have a lot of money pay for such treatment?
Well, I guess the question is do they want to Do we have to force them to? Should the state force them to? I guess the question is how much do we really need to control the behavior? How much do we think that we can control the behavior of those people? I think it's a little overly optimistic to assume that if you mandate them into drug treatment, that they're going to that it's going to be any more effective than putting them in prison. So if the government is planning their treatment, then I don't know that they're necessarily going to be able to accomplish it any better than any of the other treatment options that we have now. I mean, again, there's a lot of times it's just a lesser of two evil situations. So most likely, the most realistic option is that if we stop treating it as a criminal problem, the government is going to subsidize their treatments. I would oppose that. But that is probably what would happen. Still, I see that as better than incarceration. Sure. It's a step up. I don't agree with it, but I think it's better than incarceration.
Gotcha. Okay. Now, if elected president, there's going to be several federal health agencies under the HHS umbrella, which would be your umbrella as president. 3 of them I cover quite extensively on my website. Tell me your views on each of them and how you would change them, eliminate them, or otherwise. Let's start with the CDC.
Centers of Disease Control. So probably one of the only legitimate branches of government, simply because with the Centers of Disease Control, they monitor infectious diseases and they track outbreaks. And in terms of national security, I think that there is definitely an option there's a place for the CDC in my administration. Okay. I want to know, because again, if you're talking, a libertarian believes in private property rights. And so you don't have the right to violate other people's private property with your infectious diseases. So having a system where we can track diseases as they enter the United States, to me, that seems reasonable. I still think that there would probably be good market alternatives to it. And I would look for ways to incentivize the private market to step up, and I would allow competition against the CDC. Absolutely. Mm-hmm. But I think that's not high on my priority list of abolition. Okay.
The NIH.
The National Institute of Health. Yeah. Well, the National Institute of Health is another tough one. Again, it's the question of what good did they really do. So I guess before I could say that I really want to get rid of something like that, I'd have to consult my Surgeon General. But I'm not a doctor and I'm not an expert on health, so I can't say one way or another just yet what I would like to do with them. I get a little nervous when people start saying, "Oh, you want to get rid of this or get rid of that," even though I am a libertarian. But when it comes to the National Institutes of Health, it's just more central planning. I think that, and here's the thing, my spending plan would cut 1% of every single government program's budget. So the National Institute of Health, no matter what good they may be doing, they're going to have to do more with less. So they would be subject to a 1% budget cut under my administration, no matter how good they are.
All right. So I got about 2 minutes left with you. The FDA.
Now, that is an institution that I would absolutely cut. The Food and Drug Administration performs a function that I think could be better performed by the market. And I actually think the FDA inhibits our progress in advanced research into medicine, because it takes so long for life-saving drugs to clear the regulations that the FDA puts in place that people die while waiting for an option to take life-saving medicines. I mean, if you're already a terminal patient, what are you worried about dying for if the FDA, lets you take a pill, if you were to take a pill that the FDA said that you weren't allowed to do? The Food and Drug Administration, to me, is one of the institutions. That would be one of the first on the chopping block to me, because again, I think that there are enough consumer agencies, and there's definitely enough evidence and research that shows that consumer agencies can step in and fill in the gap. And people should have the right to do what they please with their body, their food, and their drugs, and choose what medicines they take. So yeah, I guess I am very hostile to the Food and Drug Administration. Okay. I'd put them on the chopping block, absolutely.
All right, and I got about 45 seconds, so sorry I have to cut you so short, but I am running out of time. Tell my audience about your consistent pro-life ethic.
So consistent pro-life ethic means that not only are you pro-life for the unborn, but you also are opposed to the death penalty. So that means that you are consistently pro-life from conception to the end of your life, that the government should take a pro-life position. And to me, I think that what that means is that it is a human being, that is, whether you are born or not, you are a human. We should respect all human lives. And that when it comes to the death penalty, the question is does the government have the right to kill you? Well, the problem is that they say around 4% of people who are killed every year have been exonerated, found not guilty. And so are you going to, how many innocent people should we allow to die in order to punish the guilty, who are ostensibly guilty? And it's extremely expensive because of the appeals process for people who get the death penalty. I'm opposed to it morally. The state should not have that power.
All right. Well, I am out of time now. Thank you, Austin Petersen, and good luck at the upcoming LP convention.
Thank you very much, friend.
You bet. Take care. All right. Well, that wraps up the first half of the show. Just to let everybody know, I did contact the Trump